Good afternoon, everyone. And once again, thank you for your patience and flexibility. Your commitment to being here today is something that we all truly appreciate. And since we were running a bit late, we're going to go ahead and jump right into it. So if we can go ahead and start the slides, we're going to welcome you to the Thought Leadership Series hosted by the National Reentry Workforce Collaborative today. And our moderator, our special guest moderator, will be Dr. Harry Alston from the SAFER Foundation. Harry is a Senior Vice President of Strategy and Innovation at the SAFER Foundation and also has had a storied history of working in the workforce development field, along with acting as a educator at historically Black colleges and universities. And we welcome you here today, Harry, if you want to join us on screen. And from here, I will be here to moderate in the chat pod. Again, for anyone who wants, please introduce yourself in the chat pod, where you're joining us from, your organization, the region, your position, so we get a good sense of who's on the call. And if you have any questions to get us started, that would be wonderful. And with that, I'm going to hand it over to Harry. Harry, welcome. We're really grateful that you're here with us today.
Well, thank you, Jennifer. I appreciate having this opportunity to join the National Reentry Workforce Collaborative Thought Leadership Series. I am very pleased to be joined today on the panel by Dr. Glenn Warren, Jamie Williams, and Stephanie Butler, three individuals who I think will really bring a personal, passionate, and very knowledgeable perspectives to this discussion today on the impact and the promise of holistic reentry workforce models. Wow, that's a mouthful. I'm not sure I'm going to be able to repeat that all day long, but I would set the stage by saying that both Dr. Warren and Mr. Williams are here as part of Fathers Forever, an organization in the Carolinas that really focuses on centering the importance of fathers being contributing and positive presence, not only in their families, but in their communities. And Ms. Butler, who comes to us from Philadelphia, Pennsylvania, and represents the Institute for Community Justice, where they, in fact, look to bring a broad, comprehensive array of services to individuals that really personify, and I feel almost silly saying personify person-centered practice, but that's really what it boils down to. So if each one of you would join us and say hello, I would like that.
Hello, good afternoon, everyone. It's a pleasure to be here. I'm Dr. Glenn Warren, and we look forward to participating in this webinar today.
Hi, everyone. I'm Jamie Williams, and I look forward to the webinar today.
Good afternoon, everybody. I too am honored to be a part of this. This opportunity is great for me. Thank you for having me.
I am going to take a couple minutes here and set the stage for this conversation. And then really, I'm going to spend most of the time trying to get out of these good people's way and let them share with you from their life and everyday experiences. But to set the stage, I'd like to do a couple of things. I would like to refer to the work of a couple scholars in this field of reentry. Dr. Keisha Middlemass, who wrote a book that some of you all may be familiar with, Convicted and Condemned, the Politics and Policies of Prison Reentry. And in that book, she talked about the idea, the concept that felons are contemporary outlaws. And that's not because of who they are, but because of how society sees them. Millions of men and women have to re-enter society essentially on their own. And it becomes their responsibility to try to figure out how to navigate this world and succeed in spite of the many burdens, both perceptual and real and legal, that go along with having a criminal conviction. I also would like to reference some of the work of Dr. Reuben Jonathan Miller, who wrote a book, Halfway Home, Race, Punishment, and the Afterlife of Mass Incarceration. And a couple of things that he stresses are that there are over 45,000 federal and state laws that regulate the lives of the accused, dictating where and with whom they may live, how they may live, and and how they can participate in civil society. It implores us and the reader to understand the lives that we hope to change. And I set that framework as a way to kind of set up the concept of person-centered holistic care. So I'm sure many of us have heard most recently social determinants of health, social determinants of violence, and similar type things. Well, these factors, and I'll bring them forward: economic stability, neighborhood and the built environment, social and community context, education, access and quality, healthcare access and quality, because these are all the things that we find our lives as constraints or opportunities, right? And so the idea of person-centered holistic care is about holistic care that addresses these factors. It's a philosophy and approach that centers on the elements of care that matter most to the individual, taking the whole person into account, looking beyond their present conditions, circumstances, or symptoms. So with that respect, there's certain characteristics of person-centered holistic care. It's multidisciplinary, and by that I mean there are multiple actors in multiple sectors: public, private, nonprofit. It is comprehensive. It provides multiple services, multiple supports, all focused on and being collectively responsive to the needs of the person. Person-centered holistic care is also restorative. Restorative at the individual level, the family level, and the community level. And ultimately, what's at play, if you will, is the result and the drive and the focus on building more stable, more healthy communities where the men and women that we work with, come alongside, can thrive. And so that I open up with as food for consideration as we move forward. So I don't know if there were any questions in the chat or thoughts or comments that should be brought forward, but I would like to pause to see if there are. If not, I will turn my first question to Dr. Warren. Can you tell us a little bit about what brought you and your organization to this approach and this methodology in terms of care?
Okay, as years of being a social worker from a full-time job and working with a lot of fathers and working with a lot of individuals, part of my overall philosophy has been serving each client with an individuality concept. In other words, always try to find out what's this individual about. Oftentimes we have a program that's designed for everybody, and I get that, but specifically working with individuals. So as I got into this field and started working with men in particular, that coming out of the justice system, we decided to start off by finding out exactly what the client need is, what his desires are, what his goals are, short-term and long-term, and then help him establish a pathway to get there. And that's, again, it's individual. So this holistic thing to me is the only way to go. If you want to be successful in this field, is making sure that you focus on the individual and their philosophy of life and what they want to achieve.
Absolutely.
Harry, I just wanted to join and let you know that you're on mute right now, but
Yeah.
I feel like you're saying some really wonderful
Oh,
things. that we
I'm
need to
sorry.
hear.
Thank you very much. What I was gonna ask Glenn was that as he looked at the evolution of Fathers Forever, kind of what were some of the milestones as he evolved to this more person-centered approach, and what were some of the benefits that he has seen as a result of it?
Because again, having a case manager, if you will, staff, to be more specific, work with the client on a regular basis to make sure that their goals are getting met and they're evolving. Starting out, when we first started out, we didn't have that in place. But I found out that that was important. As a retired caseworker, I just kind of brought those skills over to the population that I'm working with now, and it worked out really well. Because it's like having a coach, if you will. The coach don't play the game, but the coach shows you the concept of the game. And that's what I think a case manager is, and a person that's working with these justice individuals need the one-on-one individual help to help them get past from point A to point B.
So I want to pick up on a key word that you just talked about and maybe get the perspective of Glenn and Stephanie. You use the word coach, and so often, we hear titles like case manager or reentry navigator, right? I would like to hear what Glenn and Stephanie have to say about the interaction with these individuals and how coaching comes to play.
Okay.
I'll let you go first, Stephanie.
All righty, thank you so much again. Thank you for having me. Hello, everybody. The person-centered approach, in my opinion, is beyond necessary. Just as you mentioned, Doc, it's almost essential, to deal with people and to support them on an individual basis is quite similar to something that's happening in a body medically. Everybody, basically, we all are created biologically with the same thing. However, if you should happen to unfortunately get sick or become ill, although there's a standard way to proceed or to support, same sense, when an individual comes in, the thing that mattered so much to me was that you have to be offered an opportunity to be dealt with on an individual personal basis because needs are different. And there's no way around that. And unless you're dealt with per your needs, it's almost working backwards because you can't put the cart before the horse, so to speak. So the holistic centered person approach is the only way. And if you're looking for something to be effective. And that's pretty much my opinion because that's been my experience. My situation when I came home was a little different, but then not really, because when people become impacted, in my opinion, and when you suffer the trauma that comes along with that all the way around the board, across the board, there are certain things that have to happen. And I think reentry happens from the start prior to coming outside of the walls. Unfortunately, when I went through this process, COVID had just touched down, so everything inside the walls, opportunities to prepare people to reenter was cut off. It was 0 to none. So my thing was something I had to create for myself. So when I got outside the walls, it was really important that I was able to come somewhere where people were not only willing and able, but that were welcoming and that had an ear or a heart to want to address my issues personally, which doesn't happen, often. So it's important.
If I could just follow up on something very, very quickly, and then I will give Jamie a chance to join in. So you talked about once you're outside the walls and having someone you could connect to. Can you relate to perhaps an experience with an individual where you felt like coaching was a critical component, or listening, or any other characteristic of that relationship you would want to speak to?
Absolutely. And I'm gonna speak about myself personally. When I got home, my biggest thing, even prior to, was what was going to happen to me. How was I going to be able to move forward in my process, provide for myself, take care of my family, with these blemishes and with this life-changing process that I was in, forever life-changing. I was no longer able to go back into the field of work that I was working in, which was healthcare. I am now labeled as a felon. So there were certain restrictions placed on me. So my thing was here, I'm already feeling somewhat, if very little question, my own ability to be able to move forward. I was blessed to come into, an organization where I was under the directorship of a woman who is very special to me, who does this work from her heart, who has compassion, and who also knew and saw the need for it to be a personalized type, approach. And that's all the way across the board. And brought to my attention, because sometimes you're so involved, you're not aware of the fact that you got, you have these issues. I'm thinking, okay, I'm gonna come back out, steps, feet to the ground, and move forward. When in reality, I was not only frightened, but I didn't know where to go. So I was lucky enough to get involved with some people that say, hey, we got you. Life does happen and you do recover, especially for people that come out and have to rebuild completely. And that's almost all of us, no matter how long you've been gone or what you were doing, or even what your skill set is. So I needed people to speak life to me. I needed people to hear what my fears were and what my concerns were. And I received that, within the walls of the first stop I made, just about, because my first stop was with an organization which there are not enough of, that catered specifically to females. And through that first stop and interaction, I met and was introduced to some other wonderful folks in the same type of organization and business that made me believe that I could do something different. So, and all of that happened as a result of them listening to me and knowing about me individually and my personal struggles. And I don't know what would have happened if I would have just jumped in and just been in a system that happens quite often, where it seems like you're in a assembly line system. You come out, you're told you have to do this, A, B, and C. And nobody understands what's happening with you. Some of us aren't even able to even address any of those issues. Some of us have never had to. So it has to be personal. You have to get centered with an individual and find out where their needs are and meet them there. It's essential.
And I want to echo, it really heard loud and clear, you needing to have someone say, we got you.
We got you. You can do life after this.
And so Jamie, if you would talk a little bit about, from your experience, the importance of a coach, both in terms of having one and being one.
Well, I got out of prison after doing 45 months. I had never been to prison before, so I didn't know what to expect, and it wasn't a blueprint. So when I got to Fathers Forever, I never heard of it, didn't know anything about it. I didn't know what was going to happen. When I got here, Dr. Warren, he coached me, and other guys coached me, and they helped me build a blueprint. And I'm lucky for a program like Fathers Forever, because who knows if I would have got out, what could have happened.
Mhm.
So programs like this are very important. It helps lives, helps saves lives. So now, as a coach, helping other guys come to me and talk to me because I've been there,
Mhm.
and I can help them, and I try to help them, and I'm genuine, just like Dr. Warren is. We want to help. We do this because it's something that we really, really want to do.
Dr. Harris, you asked a question earlier about the evolution, the transition from, as a case manager, I was trained therapy and case managers, and that's what we're trained to do. When I went back to school to be a certified coach, that's totally different. So a therapy and case manager on one side, coaching is the other. And I had to transition from trying to tell people what to do as a case manager to as a coach now, listening to them and helping them do what they want to do. And to me, that is the power of the self-centered plan. Because now I'm not telling you what to do. It's inside of you what to do. And a good job of a coach is to bring what's inside of you out. And that's what I think working with justice served people is talking to them, find out what do they want to do with the rest of their life and how to accomplish that. So we train a lot of our staff now in the concept of coaching. Again, it's not my job to tell you, what to do, but like, if you're coaching and you got a tennis player and they keep losing matches because of the backstroke, they can't get it together. You bring that coach in and you show this coach will specifically spend time of showing him how to perfect the backstroke. And that now his weakness becomes his strength. And to me, it's a self-centered plan. What are you struggling with? Is it with anger? Is it with substance abuse? Those are the things that you're struggling with. How can we help you take your weaknesses to an area of strength? And so I think that's powerful as a coach, what we do, and for these guys that are coming out of prison, like Jamie. Jamie have a lot of skills. And we didn't go and say, Jamie, you need to do this, Jamie, you need to do that. Jamie, what do you want to do the rest of your life? And he began to say it. And so a lot of times people don't know until they start doing it, and they realize, oh, I like doing this.
Mhm.
Expose them to different things. And once you do that, they kind of pick up what they like and they go forward.
So if I could build on this just a second with you two gentlemen. You talked about the evolution from case manager to coach. Jamie talked about the importance of having a blueprint. So my first question is, who's the architect of that blueprint? And then secondly, how do the skills differ from case management to coaching?
The blueprint is actually the client. It's not me as a case manager. It's not the coach. It's the client. So then my job is to help him accomplish that blueprint. What is his goal? When they come to us, we sit down with them and say, okay, tell us what is your short-term goal. I want to find a job. I want to find a place to stay. I want to go back to school. What are your short-term goals? And then that's the blueprint. And that's what we did with Jamie. We sit down with him and say, what is your short-term goal? And he gave it to us. I want to get my license. I want to get my Social Security card. These are short-term goals that we help him accomplish. And so the blueprint is the client. My job as a coach is to help him accomplish that. There may be some case management in, I may have to connect them to disability. I may have to connect them to different organizations. So there are some case management involved, but by and large, it's the coaching that really, because again, the personal center goal is to find out what the individual wants and how can he accomplish that.
So I'd like to pick up on a couple questions I've seen in the chat here. And I'll start with Stephanie. So if you think about the things that make person-centered approaches different for you and how that helped you perhaps overcome some of the labels and stigma that were associated with your experience there, would you expand on that, on what makes person-centered work and how it built you up to either reduce or manage the impact of these labels in the marketplace? Stephanie, you're on mute.
My apologies. Definitely. The person-centered approach is necessary. And I believe that the person-centered approach is necessary just about on all levels. On everything that you do, basically, it should be person-centered because people are different and their needs are different. And what happens to us a lot of times in any process is that those needs personally are overlooked. So you're just shuffled. And then for some of us that aren't able to even advocate on our own behalf about what our needs are, what we need or what we'd like, just like Dr. Glenn was saying, the blueprint is yours. And it comes from, for me, the opportunity while I was away, because I after it was determined that this is what's going to happen to me, my goal was intentional, because like I said, my concern for myself was what's going to happen to me. I mean, 30 years in healthcare. I'm raising my children. I'm a single parent, finishing up a degree, and right in the middle of everything that's happened to me. So imagine that. I'm shook to my core, never having been justice involved. So I'm already feeling defeated. And not to mention, I'm 57 years old, never having had this experience. And all I could say was, why did this happen to me at this time in my life? So it's a frightening experience anyway, for anybody, especially, well, I'm not gonna say especially for women, but it's rough, you know what I mean? And then there's age and there are other things that you add into it. So when I got home, I first immediately sought treatment because I knew I therapeutically needed to be involved with people that were like-minded, that could speak life to me while I was trying to dig myself out and speak life to myself. So that was the first thing. But then I was so blessed because then when I ran and got connected with the folks that really said, listen, because my concern was, how am I going to move forward? It's super important because right on the other hand, should that not be available to you or I or anyone that might need it, you have those choices where you do or you don't. And unfortunately, people always say, oh, we feel defeated anyway when you come home. You feel defeated when you get that stamp automatically because of the stigmas that have always been in place for people like us. And then you're older, then you're a woman, you know. So I was blessed to run into women, you know, and men. There were two individuals that put their hands out for me and said, listen, you're here, this is what we're gonna do. And they supported me on pulling myself back up. I just think that people have to be dealt with mind, body, and soul. And that's what the holistic process to me looks like. So I had to get my head together to deal with what it was, which is necessary. Then I had to surround myself with folks or network and connect with organizations and or people that could show me, you know, that this too shall pass, so to speak. You know, they're doing this work. And then once I started seeing the work, it became very personal, of course, because it is. I've lived it. I have this lived experience, and I had it prior to vicariously through family members, but now it's real personal for me. And then they showed me about how do you build yourself back up? You start digging in and you start participating and being active and being in the community, and it just changes your whole everything. Everybody doesn't have that. These communities are necessary because people need to come out, and most of the people don't even know where to go, but these resources have to be made available because they definitely, I mean, I'm living proof, and I'm sure there are many, many others, these two gentlemen here, so forth and so on, that when these opportunities present themselves, it just makes things a little easier as far as the transition. We gotta believe that you can recover. These organizations and people that are in support of these organizations make us believe that there is life after these type of situations, and they're gonna happen. And if we don't have them, I've seen it happen in the work that I've done here in this office in the last 2 years. You get people that don't have the resources or never had a clue or don't know how to get to the resources, as opposed to people that have never had it, that get introduced to it and they're super excited. We've had both sides of it and I've watched it.
Great, great. I'd like to speak to the organizational side real quickly. So Glenn, this is a question for you, because I know we've got many organizational leaders out here on the call. So can you talk a little bit about how your programming success has to respond to the needs of the funders? In other words, how does person-centered programming impact the results desired by your funders?
Well, you have to, we have a lot of, we keep a lot of data, we keep a lot of information about the progress of our clients. We do weekly notes when the client gets there, when they leave, have they achieved their goals? And our funders have access to those records they need to. But it's important to keep a track of your accomplishments and the thing that you're doing with the clients and making that available. And we do a lot of communicating with our funders about our progress. What we're evolving to, the things that we're adding to the table, things that that's working. We do a newsletter, which is on a regular basis, which our funders get an opportunity to read and see the progress. We take advantage of social media. We do a lot of posting on Instagram and Facebook for our funders as well as others, and we do mass emails and let them know that our accomplishments and the things that we're doing. Funders love to see, they love the data, but they also love to see the testimonies of people who are, coming through and getting their life better, back on track. They love to see that stuff. So as an organization, that's one of the things that we focus on. We do the work, but we want to record the work that we're doing that others can see it. And my daddy used to tell us all the time, it takes a poor dog who can't wag its own tail. So talk about the goodness that you're doing. Let people see the goodness that you're doing, and they'll see the results. And that all comes with passion. If you're getting into this work because you want to make a lot of money, you're in the wrong field. You're really not good, because these clients can sniff you out. If it's just about making money, they can find out that you don't care, that you're all about making money. But if you really have a genuine desire to help people and to be an advocate for people who are, marginal, they are on the borderline, they are cast out, if you will. There's a stigma there, and you kind of make them feel empowered. And funders in the community and family members, one of the things that we always try to do is family reunification. That's a very important issue to guys coming back out of, prison. Because a lot of times they burn the bridges while they're in their addiction. They can't go back to mom's house. They can't go back to, they done messed up with the kids. So we try to teach them how to bridge those gaps and how to fix that, especially when there's substance abuse involved. And so all those things are part of the progress that we document and be able to show to our funders. And, then we have a appreciation banquet once a year. When we call this in October, but you can do it anytime, where we bring our funders in and they sit down and we invite our clients in. And we get them, get up and take testimonies, and we talk about the progress that we've made from last October to this October, what we've added. Look at the number of people we serving in the community. And we let our funders see that progress. And so the next year round, they tell us, make sure you apply for this. Because funders love to see progress. They love numbers, but they also love to see the testimonies. And they love those feelings when I'm giving something to help somebody. I could see the tangible result in this individual.
So,
And I agree with you, Dr.
Jamie, I've got a question for you, because you're kind of hands-on, managing a couple of houses, lead inspector and trainer with your detail organization or detail academy. Now, no one organization can provide the whole breadth we talk about in person-centered, holistic approaches to this work. Can you talk about how you bridge the gap to other organizations, partner with them, and bring more partners alongside you to really impact people's lives?
That was Jamie, right?
That was for Jamie, yeah.
Oh, I'm sorry. Well, with the car wash and the detail academy, we use Groupon, and we have ads on. We have our own website where people can schedule. We use Facebook and Instagram, stuff like that, to get the name out. Through the houses, we go to the food shuttle and food bank to stuff like that. So we are out in the community. And
Yeah,
So Stephanie, you guys with your organization that you've worked with, you guys have a lot of network of supporting organizations. How do you all tie them into your work?
How do we, I'm sorry,
How do you bring in other organizations to leverage all the types of services and supports that an individual will need?
well, as I mentioned, when I came into this organization, I was under a different directorship. And they already were in a very good position, because as I failed to mention, as of now, and I want to straighten that up right now, we are ICJ. I am involved and an employee at the Institute for Community Justice, but we are a program that falls under the large umbrella of Philadelphia Fight. And Philadelphia Fight already has so many different things that are supportive type opportunities and initiatives that are already in place. So the holistic and the person-centered is kind of condensed for us, and that's a really good thing, which isn't always the case for reentry organizations. We have a federally qualified healthcare center that sits on the floor above me. We have next door drug and alcohol, and we also have supports for mental illness or challenges for mental health. We have dentistry. We service the children of those that are in need. Everything that we have, we utilize that, and that comes as a plus for us. And I like to look at it as a one-stop shop, because it kind of eliminates the runaround, which is really big and is real in this process. Running from here to there, can get exhausting, and people become not only tired and beat down, but they become frustrated and discouraged. So Philadelphia Fight has all those things, but we also do boots to the ground, which is how I got started here at this organization. I came in under a 1099 opportunity, and I worked in outreach. I've always been a person who has always loved people. I've always worked in human services, and I will to the end. So we go out. We just hosted a really, really great, successful expungement opportunity on Tuesday. We serviced over 100 people, and we invite all of the other individuals, because we've established and have great relationships throughout the entire city with almost everyone and everybody, especially as it speaks to human services. So we go out, we're boots to the ground. we're community-based, you know, and this is how we reach our folks, as well as utilizing all of the social media opportunities. Instagram, we have our own page, and then word of mouth. That's basically how we do our thing. So we kind of work together in a coalition or a partnership, one to another. We get referrals from all over the place, from the Department of Probation and Parole, the Defense Association, Office of Reentry Partnership. We're everywhere. Prison Society. We're reaching out and trying to touch everybody we can, and I love it. This is personal for me. I will always do this, and I'm looking to learn something every day. I also believe that people gravitate to folks that they can relate to, because this thing has to be relational. It has to be personal.
You make a good point with the relationship building, the person-to-person contact, and what I would call the aggressive outreach. All of these things, you know, are important not only to get people engaged, but to help them maintain success in the long run. Jamie, I'd come back to you for a second, because I remember our early conversations. You talked about when you first came to Fathers Forever, you didn't have an intention of being there very long. But, you know, here you are, having worked your way up through the organization. So I'd like to know what you think about how the person-centered approach impacts retention and programming and employment. James, you're
The person-centered approach, it helps because everybody goes through different things. Everybody's been in prison for different things. I came in different, but I had to learn how to understand what a guy who came in as an addict was going through. So we have to learn before we can. I had to learn before I could actually teach. So I learned how to handle situations, how to try to understand what a person is going through or has been through. So once I got that, it helped me out to help other people. Now I understand, hey, you went through this. This is how we can help move forward. And I think that once guys see that somebody is out there helping them and they understand, they appreciate it and they try harder. They go back to try to meet those goals that they had set for themselves when they first got here. And they want to talk to you. You have to be open. We talk all the time, and I can say, hey, I did this. You can do it.
great. Glenn, a kind of follow-up on that for you. What do you think contributes to the long-term success of when we use the person-centered approach?
It's you know, it's the old saying, people don't care how much you know, they want to know how much you care. So our staff is, what we do is we try to make people feel connected. Like one of the first things we try to do is memorize when a guy comes here, the first thing we try to do as a staff is to memorize his name. And because the names are important to people. So when you time to memorize, you know, and we all say, you know, I had a bad memory. Well, it's not your memory that's bad, it's your attention that's bad. So being there, being present to the clients when you're talking to them, making them feel welcome, giving them that attention, that's what makes people buy into what you're doing, because you're helping them. And once you get that buy-in, once people know that you care, they kind of spills over in other areas of their life. When they're about to go out and use, if you got that kind of relationship with them as a coach or as a staff member, you can oftentimes talk them off the ledge. It don't always work. People do relapse. But when they do relapse, you don't, you know, kick them out, you know, immediately. But there's a time when you have to. But when people understand that you really care as an organization and about this work, reentry, they get that buy-in that makes them want to change their life.
Yes.
And there's other motives. We talk about the kids a lot. And a lot of they tell me, I don't want to go back to prison because after I've taken your course, I realized how important my role as a father is.
Yeah.
So that's another motivation for me to stop doing the craziness that I'm doing that's going to bring me back to prison. And you know, we have a lot of issues. we do have a systemic problem, but we have a personal problem as well. And we gotta fix both of them. We gotta fix this, which is another whole conversation. But let's talk about the personal one now, which is the personal center plan and how we approach the individuals and how we continue to do this work. So I don't know if I answered the question or not,
I
Doctor.
think so. I want to wrap up on this and get quickly to audience questions, but I'm going to ask each one of you briefly to offer one word of advice to our audience about using a person-centered approach. And so I'll ask you first, Glenn, then Jamie, since you guys are up on screen, and then Stephanie to round it out. So what one word of advice would you offer, Dr. Warren?
Commitment.
All right, we've got commitment. Jamie, your one word of advice.
Effort.
Effort. And Stephanie, your one word of advice.
Open-mindedness.
Open-mindedness. So we've got commitment, effort, and open-mindedness in deploying person-centered approaches to reentry and justice. So thank you all. I know we've got many questions that have been coming into the chat. So Jennifer, if you would like to assist with some of that.
Yeah, absolutely. And there's a lot of feedback in the chat pod, a lot of really insightful comments. I do want to get right to the questions to make sure that we have time to address all of them, and also open up an invitation to anyone who's not had the opportunity to ask a question or hasn't taken that opportunity to go ahead and put it in either the chat pod or the Q&A pod. But to get us started, we had a question come in from Michelle, and we had a very similar question come in through the Q&A pod as well about training from going from a manager to a coach, and how could programs create opportunities for training. So I'm going to open up this question to anyone. Does anyone have a recommendation for types of trainings that maybe you've gone through or that you've seen teammates go through that have been really powerful in helping you make that transition from manager to coach?
There's some certification in being a coach. You know, you can get those from very expensive to that's not too expensive. That would certainly help. I did do that, but I think it just having somebody who's done this kind of work. I don't know if there's a school out there that say I want to train you how to be a coach working with. I don't know if there is that training like that. I don't know of an organization that does that. Now, we can do that to some degree because it's a lot of it is learned. It's really, like I said, I don't know if there's a school out there that train people to do that. But being a coach and being a therapist, I saw the difference right away when I went to be a coach, and I realized my therapy, my case management and therapy skills is not what I need over here. I need some coaching skills. And so getting those coaching skills, I guess, from, like I said, you could go to be a certified coach, but I'm not sure everybody's not probably going to go to school to be a certified coach. But sometimes peer support, that's another organization that really talks about substance abuse. But there is training with peer support that you can get and you can use those skills not just for substance abuse, but those skills are for life skills as well. So peer support training is another important part that you can send, and you can Google that and find out. There's all kind of peer support training around here in different parts of the country.
What I would offer up for those that have an opportunity to do so in your organizations, and that is to get involved with different learning communities, very similar like we are with the Reentry Coalition here, right? get involved with learning communities, meet regularly, exchange information, test best practices that you use in your locations and kind of see where and how those things have worked out in other models and areas and circumstances in the country.
Thank you so much for that feedback, Dr. Alston. We have just another question in regards to coaching methods. Does anyone have a coaching method, not specifically a training, but one that they prescribe to or they recommend over the others?
Coaching message, I guess that would be again, which is the message would be what we've been talking about is how to hone in, and the message for that would be the personal centered plan. How do I establish that? How do I create a mechanism, the mechanics of that? I'm intentional. My intention is to be personal centered plan. What would that look like? And sit down and come up with strategies and different mechanics to make that work. One of Stephen Covey's principles, begin with the end in mind. What do you want the end result to be? And then look at how you're gonna get there. So
From a coaching standpoint, I've had several folks talk about Gestalt methodology. So that might be something you take a look at. I see other folks have entered some other information in the chat.
Thank you, Harry, for sharing that. And this is a question that I'm going to direct more towards Glenn and Harry, just because you've had the opportunity to run different organizations. How do you deal with employee turnover that becomes a barrier to rapport building, or is that not an issue that you've experienced at your organization?
Well, my observation is, first of all, employee turnover is a unfortunate fact of life. But what you have to do is kind of ask yourself, is it a factor of circumstances beyond the organization's control that leads it to it? Maybe it's something about the competitiveness of the marketplace. But I think the first place you look about employee turnover is what's the level of employee engagement in your organizations? How much attention do you pay to your own employees? I know we're all client-centered, person-centered in our approach and our missions to serve our clients. But we have to be just as passionate about serving our employees in the organization, finding ways to engage them and support them, not only in making sure that their work life is one that makes sense, but also is responsive to their needs for personal and professional development. So I think first, look there, just like you serve your clients, you should be finding a way as an organization to serve your employees.
Yeah, I totally agree with that.
I
Dr.
so appreciate that.
I totally agree with that as well. Because we do a lot of training with our staff, we do a lot of staff engagement, we do a lot of support with them. When there's an issue, we make sure that we talk to them and making sure that their needs are met. If there's issues, that we try to address it instead of letting stuff pin up and getting angry and mad. And so treating people with dignity and respect goes a long ways. And so sharing people, let people know that you care. Like you said, not only with your clients, but your staff as well.
Absolutely. I want to hone in on that for a minute. Just want to chime in really fast. I appreciate you so much for that, Dr. Alston. I do. And then earlier in our conversation, it was mentioned really fast in passing about restorative justice. We had an opportunity here to have had a program brought in, and it shut us down for a couple of days, and it was basically focused on the employees. I so appreciate you mentioning that. It is so necessary because it could be very challenging on all levels, especially for people that come every day with their heart in their hands and ready to try to see somebody leave out of the office better than they came in. And that would be our entire staff for the most part, and definitely myself. As I mentioned before, it's personal. However, I do recognize, and I've recognized that for a very long time, even in the other work that I did, that wellness as far as and self-care is so important. And lots of times organizations do forget about that or overlook it. I'm just happy to see that people are starting to engage a little more with the employees. We had an opportunity to do a restorative justice program that came into our office, and it worked very well for us because we addressed a lot of things, and it opened up a lot of conversation about things we never thought impacted us. And at the end of the day, impacts and affects how we serve people. So that is super important. It's just important all the way around. You know, in order to be a light, you got to take care of the light that happens inside of us that sometimes gets dimmed in the midst of our busyness. So, and especially when you're in the helping field, you know, it could be very challenging trying to separate the two. And I personally sometimes I struggle with that. So I got to make sure that I'm taking opportunities to rebuild and to reset. I appreciate that.
Thank you so much, Stephanie, for sharing that. I know that we all have bright lights in our lives, hopefully, and and that if we don't, hopefully we can be that for others. We just have 2 questions left. There is a question from Alex in the chat pod that if we could have our speakers answer once we wrap up, that would be really helpful. But for our last question today, we have a question come in from Jim in which he's asking that at their organizations, they're told not to share any personal information with justice-involved participants, but they're expected to build relatable relationships. How can you balance this out? And is this even possible, as they are big on sharing their own personal story? Does anyone, maybe Glenn and not Glenn, Jamie and Stephanie, do you guys have any experience with that and how you address that? How do you balance sharing your personal story versus upholding those boundaries?
For me, I'm usually a pretty transparent individual. However, I do realize, and it is totally necessary from a professional standpoint, that you do definitely enforce and have those boundaries. However, I do believe also that with proper discretion, sometimes sharing your story and availing some of your own personal history supports in a way that people are able to let go of the guards, and because we've all been a victim of being judged, and the judgment piece has to go. You know, people don't feel safe. So when you can sense that, or when needed, or when it's appropriate, I feel like it's a part of the process and it's effective. You know, although everything is not for everybody, you definitely got to sometimes, like I said before, be relational. And that means sometimes letting people know that you understand where they are, what they're going through, and you've walked that walk before. That's what gives people the ideal when they see you, that they too can recover. So it's, yeah, you know, you kind of use a little discretion, and you kind of sense what it is, you know, and when to and when not to disclose.
I tell guys my prison story, that I've been there and all that. I never go into personal stuff. And once, it's easy for me because once they know I've been in prison, I've been in closed custody, all that, they start opening up and say, hey, he know. So it's kind of easy for me, but I don't get into a lot of personal stuff. I can say, you know, I've been there, this is where I was, where I went, and all that. So I never get into personal. I just get into the prison stuff and what I'm doing now and how I can help them and how I want to help them.
Thank you so much for sharing, Jamie and Stephanie. And Harry, I just want to hand it back to you as our moderator today. Are there any final words or thoughts of wisdom that you want to share with our group before we wrap up today?
Well, I'd like to think they were wise, but I'm not going to be that presumptuous. But what I will say is I think about, I set the framework for the discussion with the social determinants of health and violence and justice, right? And so I think we got to always recognize that no one individual, no one organization is an island. We operate in a larger political, social, economic context. I think that makes it necessary for those of us that do this work, for our organizations to do a couple of things, to constantly advocate for the changes we want to see in the system. If you don't have an advocacy arm, then you should connect with organizations that do this, so we can constantly advance what we learn in our work on the ground so that it can be translated into public policy. Second, I would say you need to advocate for the needs and the growth of the individuals that we serve and also work with. So this doesn't necessarily mean that you just absolutely do what they ask and what they say. Sometimes the customer isn't always right because the customer doesn't have all the information that they need to make the best decisions, but they certainly can be advocated for, supported, guided, and coached so that, they can learn to make decisions that are more effective for them and their lives. So those are the things that I think I would leave us with, is understanding the context in which we operate, working to stretch the boundaries and change the limitations of that context, and then working ceaselessly to advocate for the individuals that you serve through your organizations and the individuals that work within your organizations.
Thank you so much, Harry, Glenn, Jamie, and Stephanie, for being with us here today. We are at time, and there are a couple questions across the board that we did not get to. If you could be kind enough, I will repost them in the chat pod, and maybe you could put some comments or thoughts into that. But as for that, this is a wrap today for our National Reentry Workforce Collaborative Thought Leadership Series. We hope to see you next time and really appreciate you joining us. We've entered in the contact information for each of our speakers and also the website for the organizations in which they represent today. Please feel free to check them out and provide support to them and their organizations, as we're grateful for their contributions today. Have a wonderful day, and we hope to see you next time. Thank you.